Hi guys, today we're looking at revising the skeletal system for GCSE PE, and we're particularly looking at the Edexcel syllabus. In this we will cover the names and locations of the bones. We're going to cover the functions of the skeleton, the classification of different bones, joints and the movement of possible joints, and then connective tissues that are associated with the skeletal system. So as we're going, just feel free to pause the video at any time, make some notes, and we will get on with it. Okay, so the first bit we're going to look at are the names and the locations of the bones. You need to know all of these different bones that are down the side of the screen, and I'm not going to spend time looking at each of them, but what you can do is pause the video and just can you identify on the skeleton on the screen where the cranium is, the vertebrae, etc. And if there's any particular ones that you're not sure of, well, that's a point to look up. Often the most common way this question is asked is usually very low scoring questions. It's not really a lot of detail in these ones, so this is probably one you just need to really quickly revise. And you most often are just saying where is the bone, identifying like they might label the here like the ribs and then have an A and it'll say what bone is marked at position A, or it might give you a name of a bone like the patella and say where's that located. So they're usually multiple choice questions, or it's a table where you've got to fill in the gaps and fill in the spaces provided. Now the most commonly tested bones are here, and this is probably the main ones you would need to focus on. So the humerus is the upper arm here. The radius and ulna are but the two bones in the lower arm, and just when you're trying to remember the difference between them, the ulna is going to the little finger, so try and remember the L in ulna goes to the little finger, whereas the radius goes to the thumb. It's the bigger bone going to the thumb. We have the femur, which is your thigh bone in your upper leg. We have the tibia and fibula. Now the tibia is your shin bone at the front. The fibula is the little bone or the thin bone at the back. Now make sure you don't spell it fibia. It's fibula. That's a common mistake people make. We have the scapula, which is the shoulder blade here, and the clavicle, which is the collarbone. So they're two common ones, and usually they ask this question when they're asking you about what bones make up the shoulder joint. So you'd have the humerus, the scapula, and the clavicle. And then we have the tarsals and the carpals. Now try to remember, these are the wrist and the ankle bones. So the carpals are the wrist. And if you imagine you're driving a car and you're holding the steering wheel, your wrist is in action there, so it's your carpals, and your tarsals are in your ankles, and T for toes. I'm trying to think ankles. So often you just need to say where it's located, like the radius is in the lower arm, or you need to sort of say what the pairs are. So what bones make up the lower arm, so the radius and ulna. What bones make up the lower leg, or it could be the knee joint, and then you have to name all the bones that join at that point. Not commonly asked in detail, so just short answer questions are fine. This area, the functions of the skeletal system, the functions of the skeleton, is a very commonly asked question, and it usually ranges between 3 up to 6 marks. It won't be a 6 mark directly, it might be broken into 2, 3 markers, but it is a commonly asked question, and it's worth investing some time because of the level of marks that you can pull out on this exam question. Often what you're looking at is how does the function of the skeletal system affect performance. So you need to have that sporting scenario as you're answering. So always just think about how's it impacting performance. So the first acronym you need to try and remember, or the mnemonic, is bones make moving joints possible, and then the B stands for blood cell production is the first function. M is mineral storage. M is muscles attachments which allow movement, and then joints for movement for the J, and then P is protection of vital organs. So these are your main functions. You can get credited if you're talking about support, which might link to things like posture, but that's not on the specification, but it does show up in the mark scheme. But I'm really going to focus on these main functions that are on the specification. So most commonly, the most common functions that you'll probably come across is protection, movement, and blood cell production. And so when we're talking about it, it might give you an image of a performer doing a particular movement, and this might be the 3 to 4 marks, and it will say, how does the skeletal system allow this movement to take place? Which you would be talking about muscle attachment, how joints work, which joints are moving, and what actions happening at the joints. It might give you a question specifically asked about protection, and then you would have to link in a particular bone and how it's protecting, which vital organ it's protecting. So when you're breaking these down, you want to firstly, when you see the exam question, you want to be careful that you're checking if it's asking you whether it's like an immediate effect. So is the movement being affected right then and there by the skeletal system? Or is it a slightly longer term effect? So the skeletal system does things in the background that won't be immediately affecting the performance, but over time will affect the performance. So first one is, if you think about it as immediate impact on performance, would be movement. So you've got the skeletal system with the joints, two bones meeting together is a joint, and you can't move without a joint. So you could describe the joint and say which bones are coming together to make the joint. Say for the knee joint, and it's a hinge joint, and then what movements can happen at that knee joint, which is flexion and extension, and then apply it to a sporting scenario, which would be kicking a ball, for example, or running. You could talk about the muscle attachment side of it, of movement, where the muscles are joined to the bones through tendons, and then the muscle contracts, which then pulls against the bone and allows movement. And you can name the muscle, so you'd say the bicep pulls against the radius and ulna to create flexion at the elbow, which would allow you, like a tennis shot, for example. You just need to think about the sporting example that maybe they'll be giving you in the scenario. Protection of vital organs is probably the most common area that comes up, and really you just need to know a couple of the main bones that are flat bones often that are protecting vital organs. So the ribs protect the lungs and the heart, and then apply it to a scenario. So in boxing, for example, where someone's taking a punch, for example, the ribs are there protecting the lungs. Or in rugby, if someone's receiving a tackle, then they're less likely to get injured. Now, the key thing is you want to be saying the name of the bone, what it's protecting, and then say that it is there for reducing the risk of injury once you've said it. But in that sporting context, so mention boxing or rugby in your answers. The cranium is the same. The cranium can protect the brain, which is important when, for example, when the most easiest one is heading a football, and you could say this reduces the risk of injury such as concussion or brain injury. So a longer term impact answer would be linking into mineral storage. So the bones can store minerals, they particularly store calcium and phosphorus, but that calcium strengthens the bones. Therefore, there's less chance of becoming injured. And if you're linking it into sport, you can say that recovery is quicker. They don't miss training through injury, and therefore can continue training. So it's always think about that sporting scenario and the effect on performance. Now, blood cell production, red blood cells, white blood cells and platelets are made in the bone marrow. Red blood cells carry oxygen, which is important for respiration and energy. White blood cells will prevent infections or help heal infections and attack pathogens. So, for example, if you're cut in a sport, therefore you won't get ill, and therefore you can continue training or you can recover quicker. And platelets, again, is an important point for creating blood clots. So if someone's injured and starts bleeding in the sport, they don't have to leave the field of play. They can continue to play because their blood's clotting. So each of these you need to say what they do, but actually the impact on performance. And the impact on performance is the extra marks that you really need to focus on. So linked to the functions of the skeletal system, and there might be some questions, like I said earlier, where you have a picture and you have to analyze the movement, say how the skeletal system allows the movement to take place. You can bring in some of the classifications of the bones, and there's another question that I'll talk about which is directly linked to particular bones. Now, when you're looking at the classification of bones, they're broken into long, short, flat, and irregular bones, and the most common types of question is like filling a table type thing, where they might say name the bone, classify the bone, and then say the impact it has on sporting performance, which is basically this example I have up the top here. And the key thing, there's sometimes extended questions, maybe 2-3 marks, where you've got get an image of a movement and you have to say how a particular bone, for example, the long bone or the short bone, is used for the performer to produce that movement. So typically the long bones are the bones that act as levers and help you to move. So your main long bones are your femur and humerus. The short bones are weight-bearing bones and allow the distribution of your body weight and prevent injuries. And that's your carpals and your tarsals are your main short bones. Your flat bones are there to protect vital organs from prevention of injury and allow for muscle attachment. And then these are your ribs and your cranium, are the two most common examples. And then irregular bones are the bones that, well, there's two types of irregular bones. These are your vertebrae and your patella. And they're there for protection as well, so, and your muscle attachment. Very rarely asked about irregular bones, so you don't want to spend too long revising these areas, but I would definitely say the short bones is probably the most common, and then the flat bones. So the most commonly, say that asked is your carpals and your ribs are probably your most regularly answered. Now the one that comes up more often than not is to show you a picture, for example, someone in a handstand or a cartwheel or something like that, and they want to know how the short bones are allowing the performer to get into this movement. So if you do get a question that's an extended type question on the short bones, you firstly need to say what the function is, and which is weight bearing, and the fact is that short bones are very strong. You could give an example of the short bones of the carpals and tarsals, depends on the angle, the image that's showing you, and it may say it in the question, so you just got to be wary on that one. Now the next key bit is what is the impact on performance. So you said what is the function. The impact on performance would be to hold the body weight. So if it's on the ankles, as you're walking or running, you're holding the body weight. If it's holding a position like a handstand, it allows the right technique to get into the right position. So these are the sort of the way you want to address it. If it was the same sort of question, say what's the role of the flat bones, you would say, well, the function is to protect vital organs. You could bring in muscle attachment, and then you could say what I was talking about earlier is to prevent injuries and give an example of the prevented injuries, but in the applied scenario, it depends on what the exam is asking you. So the next area, and this is probably the most important area to revise and the most commonly asked area, are joints. Now this is broken into two areas that can be asked individually or together, so it's really important that we understand. So the first thing you need to make sure you know are the different types of joints and the names of different types of joints down here on the left hand side, so on the side of the screen. So you've got the hinge joint, the ball and socket joint, the condyloid and the pivot joint. So you need to know, well, where are they, what are examples of them, and then once you know that, you need to make sure you know these terms and what happens at different joints. Now you won't really be asked about the movements of the ankle, but you do need to know plantar and dorsiflexion when you're analysing movements, and this is more often than not than when you asked about antagonistic pairs in the muscular system, and if it's only looking at the ankle, so watch one of the movement videos, the muscle systems video that I've put together already. So the most commonly asked question is to name the joint and the movements at that joint. Okay, so state the movement of a joint, describe the range of movement of a joint, the two types of ways the word is questioned, the wording of the question is worded, sorry, and then if they're linked together, you need to then apply it to the supporting movements. So if it's saying range of movement, now the first important thing to remember is the range of movement is from one to the other. So if we were, for example, talking about flexion to extension, so that's the range of movement, not just flexion, and it's not just extension, it's flexion to extension, or abduction to adduction. Rotation is one movement, so you don't need to worry about what it's going to. But they are the main words that we need to understand, and then you've got to think about, well, okay, which is the joint and what is the movement at that joint. So it's quite easy on the screen. You can just get a screenshot of this or whatever if you want to do. But the hinge joint, really commonly asked, and it's only looking at the knee and the elbow. Really, probably usually asked questions on the knee. And if you're sitting in an exam question, sitting in the hall, in your exam hall, don't be afraid of just lifting up your knee, extending and straightening, bending and flexing your knee. So flexing and bending it and then straightening it under the table, and just to check that your knee doesn't move in any other directions. It only goes forwards and backwards. It only opens and closes like a door. So it's flexion and extension only, and you can depend on the image, but the likelihood is it won't matter which one you put first, but you have to mention the two in the middle. Okay. Now, condyloid, asked, probably less common, but basically the condyloid is in your wrist and they can do all the movements barring rotation. Pivot joint is, again, rarely asked. It's in the neck and you can rotate your neck, but the key word is atlas and axis. That's the names of the bones that form your neck. So be sure to put them in rather than putting neck, because mark schemes sometimes just have this key wording here. Now, you may pick up a mark for putting neck, depends on how nice the examiner is. Then the other most commonly asked area is the ball and socket joint. Now, the hip and the shoulders are the ball and socket joints, and you can do all the movements at these areas. Now, what you need to be wary of is often this is the question area they ask you to analyze in terms of a sporting performance. So they use like a throwing action, or like your hips in gymnastics. Sometimes your ankles for running, but more it's going to be your shoulders and your hips. So in terms of the movement, if you get an exam question that was asking about how does a ball and socket joint help and improve performance? Well, firstly, you need to name the ball and socket joint you're talking about. So you could talk about a throwing action, a thrower. It could be a javelin thrower, a discus thrower, a shot putter, and you could choose either the hip or the shoulder. It might give you the options, or it will tell you. And then depending on which one you talk about will depend how you go and word your next set of questions, the next set of responses. So the key thing is with the ball and socket joint, and this will go for all of the answers, is that it has the greatest range of movement. So you'd say if it was a discus thrower or a shot putter, and you say the shoulder joint is a ball and socket joint, this has the greatest range of movement. There's a mark, okay? This allows the performer to generate a bigger range, but allows to generate more power, and therefore you can throw further. And this is the key bit, is the application to performance. So if you're talking about a thrower in any sort of exam question, you really want to be linking in throwing further. If it's a sprinter, run faster. If it's a distance runner, run further and maintain pace, resist fatigue. If it's a jumper, jump higher, jump longer. So you need to apply that application to performance, and it's just think about what they're doing and what's their key aspect of their sport. The other aspect you could say is, like if it was the hips or even the shoulders, that the greater range of movement allows the performer to get into a better position, into their correct technique, and then produce a better throw, which in this sense would be going further. So that's the sort of breakdown of your 3 to 4 mark question that might come on. So show you a picture and say, do the ball and socket joint, name the ball and socket joint, name the hip and shoulder, say it has the greatest range of movement. You can say, give some examples of the greatest range of movements, and then say it can get the thrower to go further and allows them to get into a better technique. So the last area on the specification in the skeletal system is connective tissues. Connective tissues are your ligaments, your tendons, and your cartilage. Now, this is commonly asked, but usually not huge amount of marks. It could either be stating the role of it, which would be like a multiple choice question or just a one-word answer, or it could be the impact on performance, and this is slightly harder and slightly longer, so 2 to 3 marks on this. Now, traditionally, they ask questions on ligaments and tendons, and there haven't been any questions at time of this recording on cartilage. So your safe bet is to revise your ligaments and tendons, and this is one that everyone gets confused. So really try to remember that ligaments connect bone to bone, and if you think about ACLs, and you hear about ACL injuries, they're the ligaments that join the knee together from the top part of the leg and the bottom part of the leg. And because they basically join bone to bone, it's at joints, and that means they stabilize your joints, and therefore preventing extreme ranges of movement. So you would say something along the lines of them being important to prevent injuries when changing direction, such as a dislocation. Now, if it's explaining the importance in the sports performing situation, you need to link it into the sport performance you're going to be talking about. So a rugby player doing a sidestep, the ligaments are there to stabilize the joint, preventing the injury while they're doing a sidestep and changing direction, and thus not dislocating their joints. If it was a tendon, okay, these join muscle to bone, okay. So this is, I was thinking about the Achilles tendon, and the fact that the Achilles tendon is at the bottom of your gastrocnemius, joining into your foot. That's the way I remember it. It's not an easy way to remember the difference between the two of them, and because it's joined to a muscle, it allows for movement. And it transmits the force of the muscle contraction down through the muscle into the tendon, and then affecting the joint to create movement. So when the muscles contract, they pull against the tendon, which then pulls against the bone at the joint, and it creates a movement. So when you're doing this, mention the name of the muscle you're going to be referring to, what they're moving, and then the action it's creating. So in this scenario I've got on the screen is the hamstrings, but you could say the biceps pull on the tendon to create movement at the elbow, pulling the radius and ulna into a flexion position. Triceps go the opposite way in extending. So you can go for any of them. Now, there haven't been any questions on cartilage, but if we're keeping the same sort of key points you want to be wording in your answer, cartilage is there to absorb shock. The cartilage is at the end of the bones, and it reduces friction, and they're shock absorbers. And the key thing there is to prevent injuries to the joints and the individual. So, like I say, it hasn't really come up, but do have the basics in your mind. Again, it's only worth probably 1 to 2 marks if you're going to get it. So finally, we are just at the last few tips before we finish off your revision. If we analyse the papers that have come up, the most common areas that you get asked are the joints and movements, and this is probably your top priority for revision. The second most common area is the functions of the skeleton, linking it into the applied sports scenarios, and then finally the next most common area is your ligaments and tendons, or the most that will worth the most amount of marks. If you went from gold, silver and bronze, do that in your main revision, and if you're only revising one thing, I would suggest the joints and movements. Just a few tips in the exams: be really clear with your definitions, very short and precise answers. You often just filling in one-word answers for some of these, so don't waffle, just get that key information in. The link to performance is really important, so it helps with mobility, helps with movement, stability and protection. What aspects of that, and then be very specific with your examples. So I've got 3 examples here. We use the shoulder is a ball and socket joint. Okay, we go this slightly short, precise point there, which allow a wide range of movement, which helps the performer throw a javelin further, ideally. Same for ligaments, and then the ribs. And all I can say is best of luck with your exam, and I will try and push a few more videos out for you.